Hello guys, welcome back to Ophthalmology on the Go. Today we are going to discuss virtual eyes, the must-have online resources for an ophthalmology resident. I've divided all the resources for the ease of understanding and me explaining to you all into apps, the websites and the social media accounts that you can follow. This video will be divided into parts. So part 1 is going to have the apps and the websites, and maybe in the next video we'll cover up the social media. Starting with the websites, first is iWiki. iWiki is basically going to be like the Wikipedia of ophthalmology. So whenever you have any questions in your mind about ophthalmology, just go on Google and search for whatever it is. Like if you have a doubt on uveitis and you want to know a little more on uveitis, just type uveitis in Google. And when it gives up options for reading up more on uveitis, select the one with iWiki. Right, so iWiki has a comprehensive details about all of the everything that is required to know about that particular disease or drug or condition or any therapeutic procedure. It has everything on it. So iWiki should be your go-to source. Even when you're in clinics, bedside, just in the OPD, you want to figure out something real fast, real quick, iWiki is your go-to. Second is iLearn. So iLearn is basically a website which was developed by Dr. Kriti Gupta and Dr. Saurabh Deshmukh. It is a guide for ophthalmology postgraduates during residency as well as during fellowships. I'll just go through what all it includes. It includes topic-wise DNB exam questions, which is going to be very essential resource for you all before you start your preparation for your DNB theory exams. It is going to be like your Bible. You have to check in all the questions, figure out all the answers to all the questions in that in that book or the PDF that they have. And if you've done everything, then I'm pretty sure you're going to pass the exam. I'll have another video covering on how to study for practicals and theory exams in DNB, and that is for a later video. The second important resource that iLearn has is iLearn Notes. So iLearn Notes are very high quality notes. It doesn't have notes on all the topics in all the subspecialties of ophthalmology, but it does have some for a few. And I would advise you to go through the topics that they have covered, because they have covered it very thoroughly and they have referenced very standard books of ophthalmology and the specific subspecialties. And I found them really good, especially for the ones that I remember very distinctly are in glaucoma, like post-op, day 1, shallow, AC, and even corneal chemical injuries. These were two that I remember very distinctly and very nicely they have given, and even keratoconus is very nicely given. And the next is the OSCE source. So OSCE is going to be very important for your practicals, practical exams. So they have, I think, they have collaborated with Narayan Nitrale, and they have a set of OSCE questions dividing them into subspecialties. And I think they're quite high yield OSCE questions, very high level OSCE questions. And if you can go through these before your exams, I think if you can solve these, you will be in a good place in your practical exams. And then there are DOS times compilations. So DOS articles are basically Delhi Ophthalmic Society. Delhi Ophthalmic Society writes out articles on just like the most common or the most upcoming topics in ophthalmology, and these are from where you'll be getting your theory questions in DNB. So it is a very good resource if you're looking for answers to find from the past 10 years questions. Just DOS articles are going to be a great resource when you're looking for answers of these past 10-year questions. So I would advise that you download that as well. And it does have information on fellowships that are available in ophthalmology, where, how, and for how long they are, and just information about that as well. So iLearn is a good resource. I've used it quite a lot. Next is eOphtha. So eOphtha is a little like iWiki. eOphtha will so eOphtha is going to have a lot of information on just maybe evaluation of optic nerve head, mnemonics, and ophthalmology. These are all the presentations and teaching material and writing material given by students in ophthalmology, residents and ophthalmologists, junior consultants, senior consultants. All the compilation is in this eOphtha. This is also a very important resource for me to study for tests or just to understand the basics and concepts and everything. So you go to eOphtha, and this is how the front page of eOphtha looks. Okay, so the next is eye rounds. Eye rounds is also a very important source, mainly for the atlases. And one very important thing that I did in the beginning of my residency is follow this curriculum, which is the glaucoma curriculum, the Iowa glaucoma curriculum. So I would advise you to go to the eye rounds page and uh, finish off this glaucoma curriculum, maybe somewhere in the middle of your first year or maybe the later part of first year. And also this gonioscopy.org, which helps you figure out how to do colonoscopy, what are the findings that you see, what are the conditions, and what specific to look in various conditions of findings of gonioscopy. And I would advise that a lot of places, don't allow residents to do colonoscopy freely, but it is a very important skill to learn, and it will make you stand out because residents as such are not, encouraged to do colonoscopy or AT, but they are very essential skills, and I think you should pick up during residency itself. So these two things, and eye rounds are good for atlas videos. And yeah, so in your free time, just keep going through the atlases. You might figure out something, and then maybe in the exam, something might just light up in your brain. Another source is the AIOS CME, which is stands for the All India Ophthalmological Society CME, which are small booklets on topics which are upcoming or in vogue. And AIOS has very kindly just compiled all of the information on that resource or the standard of care for that resource for that topic and put it into a small book. The really small books contain all the extensive information in one place, so it's a very important resource, shortened resource. Everything that you need to know will be here. It has it is present on the AIOS page, aios.org, and yeah, on phakic IOLs, ocular oncology, DCR, how to publish femto and ophthalmology. And it also has a CME on diabetic retinopathy. I figured it out really late into my residency. DR is a very extensive topic and it needs a lot of time to compile and figure out the resources and then put it all into one place. But the CME for DR is very, very beautifully given. It has everything, all the extensive details from the management to the pathophysiology to the um, investigations and everything, the surgical, just all the vast expansive DR is combined into that book. And it's a beautiful book, very simplified. I would recommend you at least go through the DR part of it at least. So the next resource that we're coming to is the YouTube videos that are there. So YouTube videos are going to be helpful in two ways. First is if you want to go through, any passive knowledge you want to take up, you don't feel like reading today, you just want to take in some information passively and not burden your brain too much, this is a good resource. Another is surgical videos. Surgical videos is very important because no matter how much you read about the surgeries, it is not going to go into your brain, penetrate into your brain until and unless you've seen it happen. So you can either see it in your OTs, in your hospital OTs, or on YouTube. And YouTube is a really good source. So when you'll always know a day before the surgeries that are going to be posted in your OT with your consultant or with your unit. Just a day before, go through the videos of those procedures on YouTube and figure out how it is done, why it is done, what are the indications, the pre-op, the post-op, what do you expect in them, what are the challenges that you can encounter, how to overcome these challenges, and plan your OT days. That will make you stand out from your other colleagues and it will help you in the long run because what you learn on a day-to-day basis in your OPDs, in your OTs, on your ward days, ward rounds, whatever, that is what is going to help you in your theory as well as practical exams and just in the long run in life. Because the more you practice, the more you're putting it into your brain on a very, you're putting it in a subconscious level of plane of knowledge, right? So ऐसे कोई नींद से उठा के भी कुछ पूछ लेगा तो तुमको पता होगा और वो चीज तभी पता होगी जब तुम उस चीज को बार बार रिपीटेडली कर रहे हो तभी होगा जब आप रोज रोज वो चीज कर रहे हो करेक्ट so YouTube is going to be that resource and I'll just go through the YouTube channels that you can refer to. So Dr. Deepak Megur sir, they have FECO videos and a surgical trainees guide. Even I think they have for SICS as well. So you can go through those videos. Very nice, even explaining the challenging cases that are there how to go about those basics like wound construction, corneal incision कैसे बनाना है, how to do the sclerocorneal tunnel, everything they've explained very nicely. That is the first thing. Dr. Suzanne Jacob, she also explains the SICS, phaco, refractive, plastic surgeries, glaucoma surgeries. And one thing that stood out for me was these endothelial keratoplasty and desmus detachment surgeries, which I didn't find anywhere else. So I found these good for that. And Dr. Ramkrishna Tadamki, especially for phaco, right? For beginners as well as challenging cases. And yeah, you can go through them. Then All India Ophthalmological Society also has a YouTube channel of its own. I would advise go subscribe and put just ring the bell icon as well, because they regularly roll out videos which are relevant to comprehensive ophthalmologists, specialist ophthalmologists, residents in training, and yeah, they have a variety of videos, and every video is going to give you a lot of knowledge. There are case presentations, there are videos like these walk-in patients with neovascular glaucoma, retinoblastoma, retina patient. What will you do if a patient comes with floaters? And yeah, they're very informative, and there are few videos which very in short explain how to do a squint evaluation, how to do a ptosis evaluation, what should be your plan of action, the flow chart and plan of action of such patients, and just very beautifully given. So AIOS all encompassing resource, I feel. And also YouTube Yosi has a YouTube channel. Go hit the bell icon on these channels. Very useful. Yosi additional benefit that I found was it's for young ophthalmologists. So they concentrate a lot on the development of a young ophthalmologist as well. Apart from the educational videos, they also have videos on how to go about residency, how to make time to study in residency, what are the major setbacks for a resident, and how he can publish more videos or I'm sorry, publish more papers in residency, and all of those the things that are relevant to residents as well. You know, fellowships and all of that. YouTube you see. I focus online. So I focus online rolls out videos by every week, I think, if I'm not wrong, every week from experts. So there is an expert on that specific topic who is going to teach you something on that topic, and then there's going to be a question answer round. It is very useful just before the exams when you want to brush up on that topic, don't feel like reading the whole thing. I would advise. I have very nicely, they have Dr. Santosh on our sir's video on thyroid eye disease was just very wonderful. That was my source for reading thyroid eye disease, and I have just done that much for thyroid eye disease, and it was sufficient even for practical and even for my theory exams. So yeah, I just go through these videos for eye focus as well. It was a helpful tool. The diffraction videos by Dr. KP, Dr. KP, so right. So yeah, a lot of videos help for eye focus as well. You can refer to that. Arvind Eye Hospital Oro Tube for beginners when you're starting out SICS. They have specific videos for first the sclerocorneal tunnel making, then the rexis, and then the nucleus management. What are the various techniques? How you can do it right? What is the exact way of doing it right? Very useful. Just before going into my SICS cases, I used to make sure that I saw these videos of the specific step that I was having a problem with. The next are the modern core videos. These are helpful when you are doing like specific examination videos like this neuro-ophthalmology for pupil. There are squint evaluation videos, and then there are process evaluation videos. So these specific examinations, they tell you exactly what is expected of you like on an international standard. So it doesn't, like there's no question of doubt of is this correct or not. Ekdam standardized, right? So go through modern core for those standardized examination videos. Next is neuro-ophthalmology with Dr. Andrew G. Lee. So the next is neuro-ophthalmology with Dr. Andrew G. Lee. So he basically explains everything on a whiteboard, all the exotropia classifications, Horner syndrome, or the neuro-ophthalmology related stuff. Very simply, he just simplifies it very beautifully and explains it. So I have referred to a few of his videos, and they were really nice for the understanding part of it and remembering part of it. Shankar Academy of Vision has videos on case presentation, and a few experts talking on specific topics like squint evaluation. I remember doing squint evaluation from their videos, and it was very, very nice. It included both the motor as well as sensory evaluation, why we do this test, why we don't do this test, which is better than this test, and in such a patient, will you do this test or not? So all of that, and even the CRVO video, and there is one OCT video which is very, very beautiful for this. I think Dr. Pradeep was the one who took it. Dr. Pradeep, and even the squint evaluation, and all the videos in general are quite nice. And coming to a few apps which I would advise you to keep handy is the eye handbook. It has all of these things: the eye calculator, transposition, visual acuity calculator, dry eye disease calculator, glaucoma risk, thyroid. So a lot of things that that you need to commit to memory are in this. So you can just refer to this, download this, and keep it with you as and when you need it. Another is the AAO Academy app. Uh, uh, two, it has quizzes, weekly challenges, latest media, which is any publications that have happened, and it also has the Will's Eye manual inbuilt. So you can just go through the Will's Eye manual in this. That is for free. Just these weekly challenges that you are supposed to solve are what you need to pay for. These don't open unless you pay for it. It is a good app to have. Open it, start using it, get used to it. It'll help you a lot. And also has videos on performing procedures and case discussions. So those are also very helpful. IGO, which is the Indian Journal of Ophthalmology, um, they come out with a publication every month, and it's very useful to go through it because it has the latest articles, the latest buzzing topic that is in vogue right in ophthalmology. Just go through it. It'll help you. It has all these review articles as well, which will help you to write your answers in your exams and just get a brief overview of the whole topic in just a few minutes, right? So that. And with that, thank you for watching, and like, share, and subscribe if you were interested in video and if this video has helped you, and please help my channel to grow. And if you have any questions, I would be very happy to answer them. Please leave them in the comment section, and yeah, see you until next time. Bye bye.